Welcome to a Furthermore Forum. I'm Elena Sparks, your host and founder of Furthermore Ventures, and I'm so happy that you're here. I am elated, really, to have Lynn Dudley of LERA Health with us today. If you've ever felt overwhelmed by labs, tests, untreated symptoms, or the constant stream of health data coming at you, this session is definitely for you. Today, we're bringing clarity to what actually drives women's most common health symptoms, whether those symptoms, what those symptoms likely mean, and what steps help women feel better faster. Whether you're here for your own health or because you care deeply about a woman in your life, partners, daughters, mothers, colleagues, and friends, you are absolutely in the right place. Before we dive in, I want to take a moment to share just a bit about Furthermore Ventures and why we host conversations like this. At Furthermore, our mission is to educate, to create connection, and invest in women who are building a healthier future. I am most passionate about our deeply interconnected health system and food system, and the women who are innovating within these systems that were definitely not designed for our health. I believe that our healthcare system was designed for disease management, not prevention. I believe that our food system often fuels this poor health and both lead to failed human health and the health of our planet. We back the innovators building solutions that make people healthier, communities stronger, and the planet more resilient. This forum is part of that mission to bring clarity, to bring access, and a better understanding of the forces shaping our well-being. Before I introduce Lynn, I just have to make a disclaimer because we are an investment company that this session is for educational purposes only and does not constitute an offer to sell or the solicitation of an offer to buy securities. With that said, let me introduce Lynn. I am thrilled again to be joined by Lynn Dudley, medical director and co-founder of LERA Health, one of Furthermore's portfolio companies and an organization truly transforming preventative root cause women's care. Lynn is a physician assistant, a functional medical practitioner, and a women's health expert with over 20 years of clinical expertise. She holds a master's degree in health science from the George Washington University and has recently earned her doctorate in medical science, yay, completing a doctoral capstone focused on the relationship between the gut microbiome and infertility. Her work bridges clinical practice and emerging research with a particular focus on translating microbiome science, advanced diagnostic data, and lifestyle-based interventions into practical patient-centered care. At LERA Health, she applies a whole body, systems-based framework to address hormonal, metabolic, gut, and nervous system health, helping women feel better now while optimizing long-term health and disease prevention. So thank you again, Lynn, for being with us today. I'd love to start with where you started in practicing functional medicine and what in particular was your inspiration.
Yeah, thanks for having me, Elena. First of all, I so appreciate the invite and our continuing collaboration with Furthermore. I got into functional medicine by accident, but then it truly became a passion of mine. So I went from being an accountant to being in the medical field simply because the doctor they went to work for was close to my house, and it happened to be a functional medicine practitioner. Um, I went back to school as a single mom with three kids, not really knowing what I wanted to do in the medical field, but quickly discovered that if I was going to practice medicine, it had to be in this root cause functional medicine approach. This really became, I don't think I've ever told you this story before, Elena, but this really became crystallized for me. I had my first panic attack in May 2012.
Wow.
And it came as a shock, as it does with most people in the medical field. We tend to ignore our problems. That's just what we're the worst patients ever. It's a true thing. And I had anxiety and panic out of nowhere. And I ignored it for a really long time until one day it became apparent that I couldn't do my job very well anymore. I had patients waiting for me, and I'm literally in the back bathroom doing deep breathing exercises so that I can go treat them. If you've never had anxiety before, it's not what you think it is. It's truly an all-encompassing feeling, like you feel like you're going to die at any moment. But anyway,
Wow.
I had to figure out why this was happening to me. And I became my own patient. And I learned that those were just symptoms. They were signals. And this should have been obvious again because I was in the field. But I ignored all the symptoms and I ignored the signals until finally I did every test at my fingertips that I could do, tried every modality, tried every supplement. And what I discovered is that there were some clear things going on in my life in the time. I was 42 years old and I was perimenopausal. Ding, 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 ding.
Mhm.
And what I didn't even put two and two together at the time is I would have these anxiety attacks at the same time every month. Should
Mhm.
have been obvious that they might have been hormonal, but it really took me digging again, doing all the testing that was available to me. And I was lucky because I did have all the testing available to me, often at free or reduced cost. Um, and there was a moment I remember like yesterday where I said, there has to be a reason why I went through this. And the
Mhm.
reason is I'm supposed to help other people. I'm supposed to help other women not to have to go through that. And so that was really a turning point for me in terms of really stoked my passion for functional medicine. And that really is the root cause of, not the root cause, the birth of LERA is all about how do I make sure that a woman living in Kentucky or
Mhm.
Alabama who doesn't have money, who doesn't even know what functional medicine is, doesn't live near someone like me, could get this testing, could get this type of treatment, to have somebody who really can be in their corner and dig and get really understand what's going on with them and help them feel better. So that's kind of my why behind functional medicine. Is just years of working with thousands of women have taught me that symptoms are just signals, they're clues. They're
Yeah.
not something that you should band-aid away with prescription medications. And when you do the right testing and work with the right practitioner, those very signals that you used to hate and want to get rid of can be a godsend because they're what's really driving, what can be a life transforming thing for you. So that's my.
Thank you for sharing. No, I don't think we actually ever talked about that. So I appreciate that. It's very powerful. And now I completely understand your passion. Just because you mentioned it, and because I think it's important, Lynn, can you tell us like what is this anxiety attack, panic
Yeah.
attack? What is this? I mean, why were you surprised? What were you feeling? And you actually didn't associate it yourself to having a panic attack.
So anxiety is a sneaky thing because it makes you feel very physically unwell. And for me, it showed up as like headaches and dizziness, like I was going to pass out. Um, it made my periods much worse. It made
Mhm.
my gut health much worse. And because your autonomic nervous system and that being stuck in fight or flight impacts every other system in your body. So when it goes, everything else goes. So it was showing up in a way that fooled even me at first because you can go down this rabbit hole of, oh, I need to go see the gastroenterologist and I need to go see the neurologist because I might have a brain tumor and maybe I have an autoimmune disease because I'm achy all the time. And this happens to people all the time. And these are the people that show up in my office too. So I always have my radar up about autonomic nervous system or like, like which system do we really need to look at, which we'll talk about in
Mhm.
a minute.
Yeah.
But the point is, for me, it was a little bit of everything. And it really took doing the deep dive into all the, I had to rule out some things that let's just make sure I'm actually not dying.
Yeah.
And
Yeah.
then really get to, oh, I had terrible estrogen dominance. My hormones were very, very out of balance. Oh, I had some food sensitivities I didn't know I had. Oh, my saliva test showed that my cortisol was off the charts, especially at night when my anxiety was the worst. So when you really start going through all the things, it made perfect sense when I
Yeah.
connected the dots and put all the
Sure.
pieces together. But it shows up so differently in each person, and no one experiences the same. Like my experience with anxiety could be completely different than somebody else's. But it oftentimes is a very physical feeling that can fool you, can fool even practitioners. And it takes a very experienced person. And it made me a much better practitioner going through all this on my
Yeah.
own,
Yeah.
obviously, because now I see the patterns. I know what to look for. I know what's maybe not so important. And you can really
Yeah.
distill it down into what I call that the four most important body systems that
Yeah.
all women should know about themselves, I think yearly. kind of like a women's executive physical. What's your gut health like? Are your hormones in balance or not? What's your metabolic health like? Is your blood sugar all over the place? And is your autonomic nervous system cooperating or is it hurting you? Is it going to let you heal or is it going to keep you stuck? And if
Yeah,
you can understand those four systems, you can unlock a lot.
I love it. Yeah. Thank you. Before we get further, Lynn, I'd love to um, kind of explore the difference between like alternative, I'll call it alternative medicine, because the standard, unfortunately, is conventional care. So, alternative care being maybe functional, natural, holistic, integrative. What's the difference, and what is functional medicine?
Yeah, that's a great question. When I first started practicing medicine 20 years ago, um, it was called alternative medicine at the time. I don't like that title. It makes it sound like
I don't
it's
either.
not
Yeah,
science backed or it's something different. And we've kind of gone away from that term. I think nowadays more you'll hear the terms functional medicine or integrative medicine or holistic medicine, root cause medicine, whole body, like they all have, I think people use the terms interchangeably. They're a little bit different though. I think functional medicine, which is what I believe in the most, what I use the most in my practice, is it's really a whole body, systems oriented approach that gets to the root cause and looks at the body holistically. So I'm throwing a lot of terms into that definition because, the root cause medicine is not a whole separate field. Holistic medicine is not a whole separate field. There's the adjectives that people use, and it could be applied to several things. But functional medicine does exactly what I just described. It looks at your body as systems, not necessarily as like organs, like your heart and your liver and
mm,
your brain systems, like your gastric system, your hormonal system, your autonomic nervous system, and how, most importantly, how they're connected, how they're interrelated. That's the key that I think most people fix, and that's the key that conventional medicine is quite frankly a big miss
yeah,
because these things don't operate in silos. And I was a perfect example of that. I was not, my autonomic nervous system being completely on fight or flight made my hormones a wreck and made my gut health a wreck and made it harder for me to keep my blood sugar balanced. So you have to look at these systems as a whole and get to the root cause of why I felt like crap. So I think functional medicine is a better term. Integrative medicine is a little bit different. It integrates conventional medicine with functional medicine or with these, a more root cause approach. It takes kind of the best of both worlds. And that's a great approach too, because I don't think that all conventional medicine is bad. I'm not anti-medicine. I'm not,
mm,
I'm a huge, as you just mentioned, I'm a huge fan of science, and we can't ignore that. And I think straddling what's the best of what science has to offer with what's the best that we can do in terms of being proactive and wellness focused. And yeah, keeping people off medicine if we can help it. So it's not an either or. They're both very complementary and we can use them in conjunction. But I think where, conventional medicine misses a bit is it's much more, it's reactive. It's
yeah.
show up with a problem and then let's just band-aid it versus we're more proactive. Let's dig deep. Let's get to the root cause. Let's use some of these foundational tools that we have to prevent problems from happening.
Thank you. Um, so you've talked about these systems, these core systems, a couple of times now. I'd love for everyone, including me, to understand more about why these four systems, and also importantly, if you can add, is this like just for women, or like in the men who are listening, like are these the same four systems for them that are also the most important?
I'll take that question first.
Yeah,
Yeah, it's the same for everybody. It's absolutely the same for everybody. Um, Men's health has a few unique things to it, but at the end of the day, it's the same core foundational systems to start with. Why these four systems? Because when you've seen, like anything you do for long enough, you see patterns, right? I don't care if you're, a bank teller or, auto mechanic or like
Yeah.
whatever your job is. If you've done it long enough, you know your job really well. And you see patterns and you see things over and over again. And I've seen enough of this over the last 20 years, working with thousands and thousands of women, I see the same patterns over and over again. It's very common for a middle-aged woman to show up in my office with the same stuff going on. It might present a little, nuance here and there, but they almost all have something going on with their hormones.
Hmm.
They might have been diagnosed with PMS or PMDD. Maybe they have now been diagnosed with IBS because they have gut problems, and they've been diagnosed with anxiety or depression. They're gaining weight and they don't know why. They all show up with some similar patterns that cut across all these symptoms that I mentioned. Now, you may be thinking, but what about the other systems, Lynn? What about her immune system? What about her heart health?
Her
Of
heart. Yeah.
course, those are extremely important. But at the end of the day, if you don't take care of those four foundational things, guess what? Your heart health's going to suffer and your
Mhm.
immune system's not going to be as strong. I look at them as kind of like upstream a bit. Downstream, the most foundational thing is if your gut health sucks, so does your immune system.
Yeah.
If you've got inflammation in your body, your heart health will suffer. Your cholesterol might be high, but does that really cause heart disease? Or is it the inflammation in your body? Is it
Hmm.
your diet and lifestyle that's contributing? So I look at those still as upstream problems where I'm still over here.
Hmm.
So it's not that I'm ignoring those things. It's that even if you've had those problems, I have to start with these four core things.
These foundational.
Yeah, and that's just through years of working it out because I used to you know, you early on in your career, I think you learn a lot from your first patients because quite frankly, you make mistakes. Like again, in any profession, you may not be your best when you first start practicing. And I think, in the early years, you try to do too much or you get a little overzealous and you
Mhm.
try to tackle everything at once. And you learn that if you start by, I'm going to support this person's immune system. Let me give them some zinc and some vitamin C so they don't get sick as much. You miss the forest through the trees. What you really should have done is figure out why her immune system's weak. Why is she more susceptible to these things? Even with or something like autoimmune disease. Okay, you've got autoimmune disease. Your immune system's attacking itself. You could go see the rheumatologist and you could be put on some, really nasty drugs. Or you could figure out what the triggers are, because yes, there's triggers for that too. A lot of things have genetic predisposition, but a lot of things have something that lights the fire. And again, those foundational things come back to the four core systems. There's a reason why more women get diagnosed with autoimmune disease than men. Why? Hormones play a role. Most of my autoimmune patients have some sort of gut health dysfunction or food sensitivities. So again, time and time again, you see these patterns. You know what, Lynn? Just start with those four things, and you're going to take care of a lot of people's problems. So it's just the distilling down of what it really matters the most. That those four things were chosen for a reason, a very, very particular reason.
Your experience. Yeah.
Yeah.
Thank you. Um, so thank you for clearing that up. It leads me to think though, like, what are we testing for? So we're focusing on these four systems, which
Yeah.
we get now as being very foundational because they give us clues about other things happening upstream. Um, but how do you know what to test for? Like, what are the biomarkers that everybody's talking about biomarkers? Probably a
Mm,
lot of people on this call and folks who are going to watch the recording like have done all the like 100 biomarkers
yeah.
times over. And maybe they're asking their doctor or they're getting tests through Aura or whatever it is. Um, what are the most foundational biomarkers within these four systems, I guess, that
Yeah.
that we should be looking at, that we should be paying attention to?
So So there's a biomarker bonanza going on, right? Like
Yes.
there's a war out there. First of all, the fact that there's even like customer driven testing right now is like, I'm still wrapping my head around it. I mean, 20 years ago, again, like a patient could not have access to ordering their own tests. And it used to be like a horrible thing that happened in the office if a patient saw their test results before
Right.
we did, and they
Right.
would freak out about it, and they would call. We didn't have electronic records back then, so they would call and they would leave a panic message. This marker's high. I mean, we've come so far from that now people can just order anything they want, and now they're getting dumped with all this data that, quite frankly, I think there's a lot of people jumping on the bandwagon right now because they see an opportunity. Sorry, tech bros out there, but there are people that are just starting companies because they can see that they can do testing now, and they're not really testing, in our opinion, the right things. They're just bragging about how many biomarkers they're testing, and some of them are quite not important, or things that your primary care could have ordered and you could have gotten covered by your insurance. So that's a whole other
Hmm.
discussion. But what do I think should really be tested? So it's a combination of things. And this is how, we are a little unique in this. Because going back to what I said, I think women and men, there are a few things that you need to know about yourself, only some of which you can get through your blood work. The rest of it has to come from other bodily fluids. But from blood work, we've chosen things that are either not checked by your primary care, or we may have a different interpretation of them, a different
Okay.
standard for where we might intervene. Like thyroid's a perfect example. You might get a doctor to check your TSH, maybe your free T4, but your primary care, trust me, is not checking something called thyroid antibodies, which can identify something called Hashimoto's, which is very, very common autoimmune attack on your thyroid. And a person can have high autoimmune antibodies even before the TSH is impacted. That's important. She can show up with hypothyroid symptoms. And yeah, it's an autoimmune disease, so that puts you in a category that
Hmm.
needs a little further investigating. So that's an example of something that you're not going to get your primary care to do. Let's take blood sugar as another example. You might get a fasting glucose done as part of a yearly workup from your
Right.
primary care. You may or may not get something called a hemoglobin A1C, because most doctors might only do that if you have diabetes or there's concern that you might. And they're not going to care about it unless you actually have diabetes, which is hemoglobin A1C of 6.5. 5.7 or above means you're pre-diabetic, but
Mm.
probably around 5.2 means you're already on the slippery slope to problems. So being more proactive about an insulin resistance problem early on is huge, because insulin resistance is one of the main drivers of inflammation and chronic diseases like heart disease,
Mm.
of course, diabetes, even cognitive decline, Alzheimer's. So we are much more aggressive at being more proactive about intervening sooner. So
Okay.
biomarkers, blood sugar stuff, inflammatory markers, deep dive into thyroid, nutrient markers, food sensitivities. Those are things that we're checking through blood. And then I think what's really unique about, and let's talk about LERA for a moment, is that the other systems that we talked about need to
Yeah.
be checked for a different way. You're not going to understand someone's gut health through their blood work, quite
Right.
frankly. You're not going to understand autonomic nervous system through blood work. And even hormones. I think that let's talk about that for a minute, because hormone testing is a kind of a controversial thing, because it's not something that the Menopause Society or the American College of Obstetrics and Gynecology even recommend that you do. That, like, why would you check your hormones? That's not a
Yeah.
thing.
That's why mine weren't checked for years. Yeah.
It's not a thing. I hope the tide is turning, but we're not there yet. So it's still, if you go to even your GYN and ask for your hormones to be tested, they're gonna say, like, no, there's no reason for that. Um, we think differently. We're not the only ones. A lot of people are starting to understand the power. Going back to my story, it was extremely important for me to understand that my hormones were completely screwed up. Because when you're going through perimenopause, you get actually a lot of estrogen. You get a lot of estrogen surges even at inappropriate times during your cycle, which for me was a big trigger.
Mm.
And at the same time, you get a drop in your progesterone. That's really, really, really important information for a woman to have because you can do something about it. And it doesn't involve just putting them on birth control. There's ways that you can balance that out. We use saliva to check hormones during the luteal phase of your cycle. There's other ways to do it. You can use blood, you can use urine. We use saliva. Uh, I just think I couldn't do what I do without understanding a woman's hormones. It's just indispensable. Um, in saliva, we also check cortisol. So, how do you measure someone's autonomic nervous system? We talked about that a little bit already, like that fight or flight
Hmm.
um, issue that women can get and men can get stuck in, and we don't necessarily know that we're stuck there. It just creeps up on us because we might not feel anxious every day, but it can sneak up on you. How do you test it? So it's hard. In some ways, you don't need to test. You can talk to somebody and get a pretty good feel for it. There's certain traits and symptoms that they may have, but cortisol is a way to get a window into her stress resilience, her stress response. Cortisol is a stress hormone put out by your adrenal gland. It has a certain rhythm to it. It should be highest in the morning and lowest at bedtime. And if you have a good cortisol curve, it's a nice downward sloping curve during the day. And we
Mm.
check that. We can tell that. I think one of the telltale signs is obviously when cortisol is too high, or what you find a lot is cortisol too low. And that's a result of just chronic stress. You've been,
Mm.
how many of us are guilty of this? Especially women, I'll say women just for a moment, pushing through when we're tired, taking care of everybody else but ourselves, demands on our plate all the time. We're never resting. Are your brains ever resting? Do you ever feel a time when you don't have some mental burden in your life? Probably not. I mean, whether you even have kids or not, we all carry a mental burden. The body feels that as stress, as chronic stress. And we're not meant to be in chronic stress, or we're meant to be fight or flight. Here's a tiger. I'm going to fight you, and I'm going to go back to normal after that. Well, here we're fighting, but we never go back to normal. We're in this
Mm.
constant state of looking for threats, of looking for alarm, keeps us awake at night. And that's a problem. And cortisol, although imperfect, is one window into me getting a feel for where are you at in this? Do you have any resilience? Do you have any gas left in your tank? Are you on fumes at this point? Are you having spikes during the day? I mean, spike right before bedtime is one reason why people have trouble sleeping. Melatonin won't fix that. It's a cortisol problem. So you can get a lot from cortisol. And then finally, one of my passions, I have a lot of passions, but gut microbiome, as you said earlier, is another indispensable tool because the gut microbiome really truly is your second brain. You might have heard that term used before, but the trillions of bacteria that live in your gut probably are responsible for more that goes on in your body than your brain. Your brain interprets things, your brain helps you reason, but the bacteria in your gut truly control your hormones and your blood sugar regulation. It controls your immune system. It's everything. And life and our diet and our nutrition and what we're exposed to and pesticides and plastics and antibiotics and Advil and alcohol, I could go on. All of that impacts your gut microbiome. And that's another domino when that falls. You definitely could have GI symptoms, or it may show up in some other way, like you have migraine headaches, or you do get sick a lot, or now you have an autoimmune disease. Now you have
Mm.
eczema. So your gut health impacts so many things that when you see those clues, again, that's why we get back down to these four systems that you have to check them because the symptom may fool you. You've really got to dig deep and figure out which system is truly causing that symptom. So blood work, saliva, stool, that's how we understand what's going on with those four systems that all women should know about themselves every year.
Okay. And you just mentioning that made me think of like when we go to the doctor, we also, provide a urine sample. Like what is the doctor checking with urine and why aren't you checking whatever it is with urine?
Um, well, they're looking to see if you have an infection, which you'd probably know if you did. They're looking to see if you have blood in your urine. They might be looking to see if you have sugar in your urine. I think it's a basic screening test, like a CBC is. Again, I think that's more of a traditional look for a problem approach
Okay.
versus look for a root cause approach. If
A
you
root
have sugar
cause.
in your urine, well, what am I going to do about that, right? I
Yeah.
need to understand your metabolic health at that point.
Yeah.
So, there's lots of screening tests. I'm not saying they're bad, and I'm not saying that you don't need a primary care. I think the
Right.
routine primary care kind of stuff that they do is still valuable.
Yes.
They're a marriage, it's not either or, it's complementary to each other. We're just looking at different things for a different purpose.
Yeah. Yeah. So Lynn, how do we access like because there's so many things I can order, right? Like you said, good or bad, I can order things, right? Um, I mean, are there specific tests, right? Like saliva test, biomarker test, microbiome test, like, that we can access? Should we do that, or are they even like readable? Like, can we even understand these tests? Because
Yeah,
what
well,
often happens so much, and I'm sorry, what happens so much for me in particular, right? Because you know that I'll like test everything. Um, is that also what comes back oftentimes is like normal, 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 in range, in range, in range, in range. And then like I might show you those tests, and according to you and functional medicine practitioners or functional medicine period, like those ranges are not normal. Like for you, those are like serious clues into something. So I don't know. Like maybe just spend a minute or two on like, should we be doing this? And if we do, like, how do we get this done?
should you be doing it? Um, I think it depends on what kind of person you are. The what's available right now, I think we're in our infancy in this wild, wild west of direct to consumer testing. So I kind of think like test at your own risk. Because if you're feeling like shit, if you're a woman who I described earlier and is looking for answers and hasn't gotten them from their doctors, and you're doing one of these direct to consumer tests to get answers, I don't think that's the best way to spend your money because you're probably not. I think if you are looking for optimization, if you're interested in your cholesterol and your longevity, there might be a place for some of these tests. The problem is data without a strategy is just noise. And if you don't like noise, you're going to be bothered by what you get back because a lot of it is unusable because they're not giving you an interpretation that's in context for you. A lot of times it's very general or AI derived. Um, and you could probably put those test results in ChatGPT and get something similar. I'm not naming names. I'm not here to bash other companies, but it's not understanding what your unique needs are, what your symptoms are. It knows nothing about you in terms of your goals, your symptoms, why you did the test in the first place. And so that you're not going to get good, usable information back out of it. In fact, you might, as you said, just feel more overwhelmed. And people that are overwhelmed don't take action. Learned that early on in my profession too. If you just give people like 10, 15 things to do, and here's a food list of 50 things to add and 50 things to avoid, and here's 10 more supplement, like, you know what people do with that? Nothing. Because you haven't prioritized it for them. It's just test at your own risk. It is the wild, wild west right now. You just know what you're getting into. Know that you might not get exactly what you need out of it
Yeah,
because people come to me every day with these test results that
I
they
bet.
bought from these direct-to-consumer companies, and they ask me to interpret them. What do I do with this?
Yeah.
So there's another big miss out there. I don't think it's quite ready yet for.
Yeah.
what the typical user needs.
Interesting. Um, it made me think like about these like the danger of getting these tests because the ranges are often not geared toward optimal health, where so many of us who are so interested in testing, like we want to be on top of our
Optimal.
game, right?
Yeah,
So we
yeah.
want to be like in preventative medicine. Um, so you mentioned, was it A1BC earlier?
HbA1c. Yeah, that's a perfect example.
So can you give us a few more? Like I know I've got some like keen testing buddies on the phone or with us today. Like what are the other big tests like that are really indicative of core health in these four systems where conventional medicine has like very different reference
Yeah.
ranges
I
from,
mean, that's a huge one for sure. I mean, let's take some simple one, like vitamin D. Like
okay,
if you show up somewhere in the typical vitamin D range. Now, I typically use LabCorp, and the range on that is 30 to 100. So if you take one of these tests and you're in that range somewhere, they're going to tell you you're fine. 30 is not fine. 30 is not optimal. My minimum is like at least 40, if not 50. I want you somewhere in the middle. B12 is another one. There's a huge range on B12. It's like 230 to 1200. 230 is not okay. B12 is really, really important for your nervous system function, your energy, your metabolism. I want at least 600, but these direct-to-consumer tests out there, mostly because of the way most of them are set up, are just going to tell you if you're in the range somewhere or not. So you're going to get a lot of normals. They're not giving you a functional interpretation. They're not telling you what's optimal. They're just giving you the straight up reference range takeaway, which again, know what you're paying for, know what you're going to get out of it. It may not be particularly useful to you depending on your goals.
Lynn, what about inflammation? Like what's the marker that we should be looking at and what's the range there?
Yeah, so there's a couple different ones. You might have heard of C-reactive protein. So C-reactive protein there's two big ones. There's sed rate. I'm sorry, C-reactive protein quantitative and C-reactive protein cardiac. Um, C-reactive protein quantitative, I think the range on there, like it might, I forget off the top of my head on that one. You really don't want any. You want it to be like less than 5. But the range on that is going to allow you to be up to, I think it might be 30, but you
Wow.
want to be like 28, you want to be like 2, but you'll
Okay.
flagged as
That's a
okay.
huge difference.
Yeah,
Yeah.
C-reactive protein cardiac, you want it to be less than 1. But if it's like from between 1 and 3, it'll tell you you're average, you're fine. So most of these have different functional ranges that would put you in an optimal place versus just remember what a lab reference value is. It's just a
Yeah.
bell curve. It's just you're in the 75%,
Yep.
and that's not good enough for a lot of things. Some of it's okay, but for a lot of things that we check for, again, we were only picking the things where it really, really matters, where those reference range matters, or your doctor won't check at all.
So important.
Yeah.
Thank you for that. Okay, so I'd love for you to like give us a case example, like or two, of like where you see like a certain pattern over and over again. It might be, extreme challenge with infertility. I know one that I'd love to discuss with you because I got a number of questions about this one in the registration is like, what about midlife, like midsection weight gain for women?
Okay.
So those are two. Like, I'd love to understand like what was the case and how did you turn things around?
Okay. So I'll start with the fertility one because this is like close to my brain right now. As you know, I just did a big
Just did you paper, just
project on
submitted your
this.
paper.
And what a lot of people don't know is that your gut health impacts your fertility chances. And this came to light with a study that we did recently. LERA took several people who wanted to optimize their fertility through our program. And we did all the testing, the blood work, the saliva, and the stool. And we had a particularly challenging case of a woman who had had multiple failures of IUI, multiple failures of IVF, 2 endometriosis surgeries. She was turning 40 years old. her reproductive endocrinologist pretty much told her, you're wasting your money if you do any more cycles. We really don't think this is going to happen for you. And she signed up for our trial, desperate, last resort. If you find something, just tell me, I'll fix it. She was probably the most, out of the patients that we treated, she was the most messed up, meaning that we had to found the most things wrong with her, which kind of was a good thing because there was so much to sink our teeth into and help her with. But the most compelling thing about her case was how inflamed her gut was.
Mm.
Off the charts inflammation, really severe overgrowth of dysbiotic bacteria, the kind of bacteria that causes inflammation. To the point where if I had more time with her, I probably would have sent her to the GI doctor because I was worried about how inflamed her gut was, almost like a Crohn's or ulcerative colitis presentation. But she said, tell me what to do. Like, I'll do anything. So really it was not rocket science. It was dietary intervention. It was supporting with healthy bacteria through probiotics and fiber support. It was using some natural remedies to tamp down some of that bad bacteria. We also found that she had food sensitivity, so we got her to avoid some foods that were causing inflammation. And lo and behold, she did that one more IVF cycle and got pregnant. And it
Wow.
was, to this day, it still gives me goosebumps because it was considered like a miracle. It was considered a miracle by her doctors, by her, by her husband. I mean, it was just like nobody could believe that. Wait a second, all you did was fix her gut? Yeah. Microbiome plays a huge role in everything in your body, like I said earlier, particularly your hormones. And your body doesn't want to get pregnant when it's inflamed. Your body's really smart. So, did you think it's a really good time to bring new life into the world when there's so much inflammation that it's dealing with? No. So, we had to quiet that down. I mean, it was an amazing case. It didn't even take that long to do it. She is, as of today, probably like 24 weeks pregnant. She was
Wow.
really nervous in the beginning that wasn't going to hold. So it's like, it was amazing. That's just one example and how gut health really drove a significant outcome. And this is not on the radar of GYNs or reproductive endocrinologists. They don't know anything about gut health. And so it's an often missed thing, but
Yeah.
it's not that hard to fix. In terms of the midlife weight gain, another super common pattern that I see is women in this demographic saying, where did this belly fat come from? Like, I'm not doing anything different. I'm not eating any different. My exercise is the same. Like, and now all of a sudden I'm putting on weight in the midsection. What's going on? So there's a few different mechanisms behind that. One is your hormones. So again, everything's interrelated. So as your hormones change and you go through perimenopause, there's changes in your estrogen, there's changes in your progesterone, there's fluctuations in them both. Um, and when your estrogen drops, or where if you're estrogen dominant, both of those conditions are fat storage triggers. So
Mm.
it's not uncommon to have this weight loss occur when your hormones are out of balance or as you're going through menopausal transition. Your body, again, is really smart when it comes to menopause. When your hormones start to decline, your body senses, uh-oh, I can't procreate anymore. This is bad. This is biologically what I'm here to do. I don't want to survive as long as possible. I need hormones. What am I going to do? So you can make a little estrogen in your fat cells. So one of the things it does to try to survive longer and keep making estrogen is it puts a little extra layer of fat on you. It's not necessarily a bad thing. Biologically, your body thinks it's helping you. We don't appreciate it,
Mm.
especially when it's around the midsection. But studies show that like carrying a little extra weight into your later years is actually better for your longevity than being a frail, thin little elderly 80-year-old. There's bone density issues, hip fracture issues. So part of it's protective, but the other part of it is, where you're putting it on. And that's where it comes to the other factor, which is your insulin. So the metabolic changes that happen when you age and go through menopause are causing your body to no longer be as efficient in processing carbs and sugar. So even though you don't change anything, that oatmeal you used to have for breakfast, more of it's now being stored as fat as it used to be.
Mm.
And That's biological. Again, part of that's the aging process. But we're not necessarily victims to that. You know, you can absolutely change that and help that and do something to keep your metabolism being, optimally burning. You just have to work out a little bit harder. So you do have to kind of pay attention to your carb intake, and you may have to change up your exercise routine a little bit. And you might have heard about how women at a certain age need to start doing more heavy weights. You know, there's a reason for that. We burn sugar when we do that. That's important. It keeps us more metabolically active. So we have to switch things up a little bit. It's not so much about cardio, cardio, cardio as much as it was. It's weights, 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 and it's changing what kind and the quality of your carb intake. If you're putting on that little bit of extra fat layer all in your belly, that's a sign that we do need to look at your perhaps some early insulin resistance or metabolic factors. If you're putting it on hips and thighs, maybe a little, 5 pounds everywhere, it's not the worrisome type. Again, I know we don't appreciate it because all we care about is the scale, right? But there is a little bit of it that's acceptable and normal, and I don't think we should freak out about it. It's not all about weight. It's about body composition and how much muscle you have. But if it's coming on strictly in the belly fat area, then we need to really look at insulin resistance.
Thank you. Appreciate that. Um, I do want to just check Q&A here to see if anyone has any questions. If you do, please, like I think we have about 10 minutes left or so. Please go ahead and, submit a question. I'm happy to address that. In the interim, Lynn, I will ask, like, for the women that um feels overwhelmed right now because they don't know where to start. What are the couple of recommendations, you would give to this woman who's just, is not being treated, is being, mistreated, is not being heard. She knows that stuff is going on, right? And she
Yeah.
doesn't feel well, but she has no idea how to get started.
Yeah. Um, well, first I would say find someone who can help you get to the bottom of it. Find a practitioner or LERA's launching in March. Find someone who can really dig for you and get those answers for you, and don't be satisfied with your doctor telling you you're okay, because you don't have to put up with feeling like shit. Beyond that, though, I think there's two things that we can all do, maybe three, two or three things that we can all do that you don't have to spend a dime on, that you can do on your own. You don't need a wearable to track. You don't need any testing to do. Number one is make sleep your job. Sleep is an indispensable priority that we should all make, because everything that we just talked about works less efficiently if we're not getting enough sleep. And by enough sleep, I'd say that the data shows that the best thing to shoot for is around 7 hours. Now, I certainly have people who tell me they get by on 5 or 6 and feel great. I think there's outliers to that, but most of the studies have been done on sleep quantity is 7 hours is the minimum that we should be shooting for. And make that your job. Like, it's everything that you can possibly do to improve your sleep. And here's where I do think a sleep tracker may help, like an Oura ring or something, to tell you not only what kind, what the quality of your sleep that you're getting to. Are you getting enough deep sleep? Because that's hard for some of us to achieve too. But sleep like there's no tomorrow. Like you have to do it. Number two is something that we just talked about. Your blood sugar and your ability to avoid insulin resistance
Mm,
will prove helpful to you in your longevity. And so if there's one thing that you want to make sure that you have a handle on, is getting your hemoglobin A1C checked, and your fasting glucose and your fasting insulin, which your regular doctor usually doesn't check, because that's how you're going to pick up on early insulin resistance. If you can avoid that, you're going to avoid a lot of problems. If you can get 7 hours of sleep, and that's non-negotiable, you're going to avoid a lot of problems. So people can start right there, and I'll throw in a third, and that's hydrate, which just
mm,
seems like a common sense one, but I think it's always worth reminding ourselves that you need about half your body weight in water ounces every day. Your body needs water to function. And there's a lot of things that people don't realize come from dehydration they didn't know they had, like fatigue and brain fog and even joint pain and poor
mhm.
sleep. So hydration, don't get insulin resistant, and get 7 hours of sleep.
Love it. Thank you. That's awesome. We have a question about cholesterol and why it is that, doctors want to just it's just like statins, like take a statin, here's a statin. Um, what's the like what's the
So,
issue with diving deeper? Like what's causing them not
yeah.
to dive deeper? And how do you, I guess more importantly is like how do you push back with your doctor? What do you ask for?
So it may be tough if you don't have an open-minded doctor who's kind of staying up on the research. There was a research study that came out, I think it was last week or the week before, that showed that sugar was just as responsible for heart disease as cholesterol. I mean, that should be like over like all the news all the time, right?
Yeah.
Because you've been led to believe that it's cholesterol, cholesterol, cholesterol. And that's what I learned in school too. It takes, some people say 10, even 20 years for what's taught in school and the standard recommendations to catch up to where the science is. So I think we're just behind. I think we're still just stuck in cholesterol bad, must lower it, take statin, and that's it. But, as we talked earlier, there are other drivers, many other drivers of heart disease. Cholesterol is been the boogeyman for as long as I can remember. If you don't have cholesterol, you die. It coats every cell in your body. There's a reason
Mhm.
for it. You need it. Might be a good idea to not squelch it down to nothing if we can help it. What happens is when you have inflammation in your arteries, there's like a little damaged area in your artery. Cholesterol's job is to come along and like repair it. So it actually has a viable purpose in your arteries. The problem is when we have too much of it or we have a sticky kind, and there's genetics for people who make too much or absorb too much or have the really sticky kind. So you want to know, if you have that sticky kind, there's
Yeah.
other markers that are equally, if not more important than just your total cholesterol. But at the end of the day, if you want to prevent heart disease, it's not about, well, let's just keep this cholesterol from doing its job. It's, well, let's not have inflammation in the first place. Let's not damage
Mhm.
our arteries due to what we're eating and alcohol and smoking and all the things that, all the diet and lifestyle things. And by the way, stress contributes to heart disease. So there's a lot of this that we have control over that I think that unfortunately most doctors are not willing to let you go too long before they're going to just start jamming that statin down your throat. So my suggestion would be um, understand your other risks by getting the other tests done by
Mhm.
someone else. If it's not going to be your doctor, find somebody that will. And again, be proactive as you can with controlling the things you can control. You can't control your genetics, but there's a heck of a lot that you can control. I'm not saying that I'm anti-statin. I don't want anyone to take that away because they have their place in certain situations. But a lot of it, I think, is overprescribed, especially for women.
Yeah. Thank you. Yeah, I was glad to have my doctor not immediately, but I have to say, Lynn, I walked in with like, the tests already done, the tests that you're talking about, as you
Right.
know, because you helped me with those. Um, okay, we only have a few more minutes. There is one more question, Lynn, I'd love for you to address really quickly, and then I think we better wrap up and let people know how to find you and all that good stuff. One question is on the role of health coaches and how they can help women achieve their optimal level of health.
I'm a huge fan of them for a very important reason. And that is like everything that we've talked about over this last hour is about someone interpreting the data for you, right? Like just getting data without a strategy is overwhelming and not useful. But even when you get it interpreted for you and someone puts in context and now you have a plan, it's still difficult for some people to make change. At the end of the day, true health is achieved through behavior change. Like all of this, it just requires people to make different choices every day. Some big macro choices, but a lot of micro choices. And that gets down to what motivates people. Are you are you really gung ho? Are you scared? Do you have obstacles? Do you have a family that you have to cook differently for? Are you not getting enough sleep and you're overwhelmed and you don't have time to do it and you don't have the money to do it and you don't want to go to the gym? That's what health coaches are for because they can look at your life and they can really get to know you and say, all right, we're going to We're going to make this easy for you. I'm going to hold your hand through this process. I'm going to help you implement it. That's what a health coach really does for people is the implementation piece of it, which is crucial because the best plan will
Yeah.
fall and do nothing if people don't find it actionable. And I do find health coaches extremely helpful to help people do that.
Thank you. Amazing. So I'm going to close. Thank you, everyone who joined today. Lynn, special thanks to you for sharing such clear and compassionate and actionable insights. We will be posting this session to YouTube and we'll follow up via email with the link to that session. If you found this conversation to be helpful, please take a moment to like and share that link with others. We also hope that you'll stay connected with us. You can follow me on LinkedIn and follow Furthermore Ventures on Instagram for future forums and founder stories and insights from those innovating for a healthier future. We hope that you'll follow Lynn and LERA Health on LinkedIn and Instagram to continue learning from the work Lynn and the founding team at LERA are doing to bring us root cause based care at scale. Thank you again for joining us, and we look for we look forward to the next Furthermore forum. There's a lot of F's.
Bye
Appreciate you. Thanks again, Lynn.
bye.